Hello, my name is Yanel Blanta Nitago. I am a nurse at Imara Mediplus Hospital, and during my line of duty, I have nursed several cancer patients, and today I am here to share my experiences with you.
Hello, my name is Nyakeo Koru. I'm a makeup artist and a hairstylist. I'm also a member of Sanana Kahawa. I'm here to share my experience as a caregiver, as a relative. Yeah.
Yo, so
Um, for starts, I was present from day one, from when my mom started getting sick. All those points to the stage where we got to know she was sick. Um, it wasn't a nice experience at that moment. Actually, it was never a nice experience. Yeah, it was.
Yanel, you receive many patients in your line of duty. How do you, what is the first thing families do when they get the information that their patient is sick?
So, making a diagnosis of cancer known to a patient or a relative is usually one of the hardest things that a nurse, a doctor, or any medical practitioner has to face, because this is a lifelong thing that you have to make known to these people, and sometimes it is not, or most of the times it's not quite an easy pill to swallow. Most of them are worried, they do not know what to do, some of them break down, and the effect is usually seen both physically, emotionally, and mentally.
Okay, ladies, what was your lowest moment?
One of my lowest moments as a nurse giving care to a cancer patient was when you could see a patient almost make a complete recovery only to fall back, and if they were possibly in stage 2, you hear they are in stage 3, and even some of them end up dying. This is a low moment for me because one of the basic roles I do as a nurse is to not only care for the patient but also give hope to the family, to the patient, and the society in general. And when such kinds of things happen, you are devastated and don't even know where to start from.
My lowest moment as a relative and somebody who was close to them is I have very many. One that I remember is having to shave her hair, like, of course, she was losing her hair due to the chemotherapy. That was one cause. Um, Especially, she was a lady and she had beautiful hair. So getting to lose your hair, having known yourself with that hair, is actually difficult for the patient and also for me as their child, and seeing the pain that they were going through at that moment. Also, seeing them in pain, seeing them in pain, because the pain was too much, and actually getting to see your mother like getting in pain and crying because they are in too much pain is actually so heartbreaking. And also now losing them after fighting the. Let me say, caregivers, no one looks at the caregivers, no one, because you're expected to be like taking care of them, as in right now, especially for me, mimi ni mtoto wake, like I'm guaranteed like to take care of them. But apparently, as a caregiver, we get to moments that we want to talk to somebody, and there's no one around, because you find that your friends are not there anymore, because you also don't have that time to keep up friendship, and some of them will not even keep it up with you. So I think the society doesn't really like, they just like, I think the society is biased. They are there for people when they are happy, but when people are in like a sad moment, cancer will drain you financially. So they will feel, I think they are also burdened, because at one moment you guys will call them for financial raise and whatever. I think some of them tend to pull out, or also I feel like they probably don't pull out for the wrong reasons. They probably do it for, because right now personally, if somebody is sick, I would be very scared to see them, because there's the way somebody just looks unnatural, and I don't know how to explain, but there's just that point when somebody is sick, they look so frail, and some people are not really strong enough to come and see somebody, especially cancer, and cancer will just make you look like a very different person. You look like you're dying the next minute. So yeah.
My experience is that lots of people give focus to the patient and forget that there is this caregiver, relative, or friend who is also undergoing the process where they have to come to terms with the diagnosis of their relatives, their friends. Most of them have to get their finances in check. Some of them are totally drained, and the society most of the time does not give them the focus they need, the support they need. And that's why in my everyday nursing practice, I would like to not only focus on the patient, but also remember that the caregiver is a person who is also undergoing the process alongside the patient. Also, the other thing that the society does is that they give cancer this death sentence. When somebody has a patient diagnosed with cancer, you get this worrying eyes. If you had friends, they feel like you're gonna be borrowing from them every now and then. Some of them are even afraid to walk the journey with you because they're afraid if they gave you hope and then the hope was lost. But all they don't know is that during this journey, all people need is hope and hope and more hope.
So my advice to caregivers is, I would ask them to not beat themselves up. Encourage yourself this journey. In this journey, whether your patient will get healed or whatever happens in the journey, but also take care of your mental health. Go and seek therapy. Take yourself out. I think go and unwind to some time, because it's so stressful to stay with a sick person from the whole time. To the society and to friends of the caregivers, I would also ask you to support your friends who are caregivers, or anyone who has a patient. Just go and hug them, show them love, go and help them in taking care. Kama it's just for 1 hour or something, go and talk to them, take them somewhere, go and just let them be and let them talk to you, let them share the experience. When you talk or share something with somebody, it's you feel some sort of relief. So yeah, I would ask the society and the friends of the people taking care of cancer patients to just be there for their friends. You don't need to have money or to go and support somebody. Even that hug, that I am with you, just show compassion to caregivers. Yeah, that's my advice.
So my advice to the society, and possibly my own personal mantra when it comes to caring for patients who have cancer, is always share hope, hope and more hope. I like to encourage those nurses out there to continue being those givers of hope. Do not let your patients feel like they're alone regardless. Do not let the caregivers feel like they've been left to walk this path alone. Always give them hope and more hope. Though people put this death sentence on cancer, we as nurses should continue fighting to give hope and hope until the last day regardless. Also, I like to encourage everyone out there that cancer is something that can be detected at an early stage, and early screening is the only way to come and curb and cure cancer regardless. So all of us should always take the initiative to do the yearly screens, as long as you're in the predisposed group. Keep the screens coming. Through screening, you're able to detect cancer early, because we say early detection equals early intervention, which equals cure. So most of the people out there, due to the stigma, are afraid to even get to do a cancer test, to have a screen. But all you're doing is limiting yourself, reducing your chances, just in case there's that tiny bit that you are possibly infected or are affected by cancer. So I'd like to encourage everyone out there to take up screening as a daily routine. Do it yearly, do it even if it's quarterly, regardless. Don't be afraid, and whenever you get the diagnosis, seek the needed help you need. If it's cancer and you're a relative, you can always join some groups of fellow carers, get counseling if possible, and always try to speak out your mind, because our mental health is very important. So as for screening, there are several tests that are used in screening, and we at Imara Mediplus Hospital do offer several cancer screening services. We do have the pap smears, we have the PSA, we have all the cancer tumor markers, we have ultrasound and radiology. You can always come here and have yourself tested and screened. Like I said, early screening equals early detection, which equals early intervention and equals early treatment and cure. Thank you.